Hello everyone, welcome to my YouTube channel. So I'm going to be looking at some questions that you may experience when you go for American Society for Clinical Pathology exam. So I'll provide answer and try to make further comment where possible. Can I also mention that even though this is for this exam, it can also be applicable to any type of interview you may be preparing for, whether in the UK, Australia, Canada, or maybe any part of the world where possible. Okay, remember that science remain the same. Okay, so now before we continue, my name is Dr. Emmanuel Ogbodo. I'm a biomedical scientist and I'm also a lecturer in biomedical science here in the United Kingdom. So let's see what we've got, okay? Right, now the question I'm going to be presenting has to do with thalassemia, okay? Thalassemia. So let's look at this, so like as a kind of case study, if I may say. So imagine you've gone for this American Society for Clinical exam, and then you are presented with a 25-year-old Mediterranean woman present with mild anemia. Note the word mild anemia, okay? So her CBC result shows CBC is complete blood count, which means you can also call it FBC, which is full blood count, okay? Whichever one that is best for you. All right. So this is her CBC result. Now, there is something that I've done here. Let me see if I can get my pointer. I think that will help me to further illustrate what I'm trying to say. So there is something I've done here before I continue. So this, I tried to provide the reference ranges, but when I got the question, there was no reference ranges. So I would like you to also memorize ranges where possible. And I've tried to give you the ranges, especially like something like femtoliter appear to be common, irrespective of, in different countries. But when it comes to RBC, it can change sometimes. You can have per microliter or per liter. So anyway, that's why I provided this, like this for you. Okay. Now, when you have something like hemoglobin, again, you can have something like maybe gram per DL, or you can have gram per liter. So that's why I provided it for you as well. Anyway, that's by the way. So this is this patient result. Okay. So one of the things you are going to see here, obviously, that this person has low MCV. I think there was a question they asked. Let me see. Okay. So they say, now, okay, let me continue. So this person, when you look at this result, you got to know that this person has a low MCV. Okay, but interestingly, look at the red blood cell here. The red blood cell here is not low. Instead, it is high, actually, okay? But hemoglobin is low, okay? And of course, RDW is normal. Now, looking at this, by definition of anemia, remember that the case said that it has mild anemia. Anemia actually should be either low MCV or maybe low hemoglobin or low RBC. So in terms of red blood cell, it's not suggestive that this person is anemic. However, but in terms of MCV and hemoglobin, this person is definitely what? Anemic, okay? Now, another point I would like to mention here quickly is the fact that this MCV that is low here, remember that in anemia, it can be either normocytic anemia or microcytic anemia or macrocytic anemia. So when the MCV is normal and the hemoglobin, when the MCV is normal and the person is anemic, that is normocytic. When it is higher and the person is anemic, that is macrocytic. But because it is low, this is microcytic, okay? That is MI, okay, which is microcytic, okay? Now, but they've done a further test, interestingly, and they've done hemoglobin electrophoresis. Let's say something like HPLC, for example, okay? Like high performance liquid chromatography, okay? So they've done this hemoglobin electrophoresis, and then the result showed an increased hemoglobin A2. So this hemoglobin A2, remember that hemoglobin has 4 polypeptide chain, okay? Now, what happened is that you really want to see like 2 alpha chain and 2 beta chain, okay? Now, what he's trying to say is that when you see, the reason why I put this here is to say that when a patient has, when you see something like hemoglobin A2, it actually means that this person has 2 alpha, hemoglobin and 2 delta hemoglobin, okay? So what then happens is this: if, for example, okay, if there is a problem in a case of that very maybe let's say in a case of beta-thalassemia, for example, okay, you already know that this is thalassemia. In a case of beta-thalassemia, what it means that the deficiency in the beta chain of the hemoglobin will cause increase in this very delta hemoglobin chain, and that is when you can see something like hemoglobin A2. Okay, that's by the way, I'm just trying to give you a little background. Now the question they now ask is that which condition is most likely to be the case? Obviously, because I'd already said it's thalassemia, I'm sure you'll be thinking in terms of the thalassemia, and because of what I've explained here, I'm sure you should already know what it's supposed to be, because from here, from hemoglobin A2, you are seeing that there is 2 alpha anyway, so that means the problem here has nothing to do with alpha chain, okay, and obviously there is 2 delta, okay, and I've said maybe it would take deficiency in the beta chain or deletion in the beta chain for this very delta, maybe for there to be increase in this very delta chain, as the case may be, just to replace that of the beta chain. Okay, now I said this to say that you should actually know the answer from what I've said so far, but the point I want to make here that made me to want to present is that if you look at general full blood count result, when you see low MCV, one of the things you are likely to be thinking about is iron deficiency anemia, because microcytosis or microcytic anemia can be due to iron deficiency, or it could be due to thalassemia. Okay, now, so the question, why is it not iron deficiency? That is something I would like you to consider. Okay, but anyway, let's continue. So now if you look at this, you are going to see, and this is why I tried to make this comment. Remember that the question was, they didn't give them the reference ranges. They just say a 25-year-old Mediterranean woman presented with mild anemia, her CBC results showed. They just gave MCV 68, RBC, and all of that. Okay, they didn't give the reference ranges, but I gave the reference ranges just to bring it to a better context. So from the reference ranges, we know that the hemoglobin is low, we know that MCV is low, but we know that RBC is increased, okay, and RDW is normal. Okay, now they did a further test which shows increased hemoglobin A2, which is why I said in that hemoglobin A2 you're going to see 2 alpha chain and 2 delta chain. Okay, right, then I say which condition is it most likely to be? Okay, is it iron deficiency anemia, is it beta thalassemia trait, is it a alpha thalassemia trait, or is it side blastic anemia? Okay, now before we can answer the question, which I believe you should actually know the answer by now, so I want you to note the fact that once there is a problem with the maybe if you are suspecting, because we are looking at, is it iron deficiency or is it thalassemia? Okay, so I want you to note this: low MCV, okay, then normal RDW. So I want you to note these two, okay, the low MCV and normal RDW. Okay, now note as well high RBC count. Just know that. Now when you have elevated hemoglobin A2 is characterized of what? Beta thalassemia trait, which was what I'd already explained, because this hemoglobin A2 is a suggestion that there's a problem with the beta thalassemia, and that to compensate, however, like in order to make up the polypeptide chain, there may be increase in this very delta hemoglobin chain, which is not actually what you want. What you want is 2 alpha and 2 beta. Okay, so that's what happened. That means that deletion or the absence of that beta chain, it becomes beta thalassemia. So elevated level of hemoglobin A2 is a strong indication of what? Beta thalassemia trait. Now, why I'm bringing this up is actually about the last point, which is for iron deficiency. What you are going to see is that the RDW, okay, which is red cell distribution width, okay, what is going to happen with RCW is supposed to be increased, okay, not to be normal, okay, and you're going to see that red blood cell count is going to be low. So one of the ways to differentiate, that's just why I'm bringing this here, okay, and I think that was why they gave this suggestion here, because forget that I call it thalassemia case, you already know, but if you go for that interview, they wouldn't say thalassemia case, they will just give you this presentation and give you this result and probably give you this. Now you are likely to say, oh, because it is low MCV, you might think it's iron deficiency anemia, but they've given you something like RBC is high. Okay, sometimes it can be normal, okay, even in thalassemia, okay, it may be high or normal, okay. So RBC is high here and RDW here is normal. So that should be a strong indication for you to know that this is not iron deficiency anemia, because in a case of iron deficiency anemia, you're going to see that this very RDW is going to be increased and the RBC is going to be what? Low. So meaning that in thalassemia, okay, the MCV is going to be low. Sorry, in thalassemia and iron deficiency, MCV is going to be low, okay, and hemoglobin is going to be low. How you are going to differentiate two of them is RBC and RDW. So in thalassemia, RBC might be normal or it might be higher, and RDW may be what is likely to be what? Normal. However, in iron deficiency anemia, this very RDW is going to be increased, and this very RBC in iron deficiency anemia is going to be low. Does that make sense? Okay. So I believe with this, we now know what the answer is. So the answer actually is that what we're expecting here is what? Beta what? Thalassemia trait. That is the answer to that, because that is the giveaway here, that when you see elevated hemoglobin A2 is a characteristic of what? Beta thalassemia trait. So that's the answer to this question. A 25-year-old Mediterranean woman presented with a mild anemia. You know, the CBC shows low MCV, RBC high, okay, hemoglobin low, RDW normal. Then the electrophoresis shows increased level of what? Hemoglobin A2. That is a strong indication of what? Beta thalassemia trait. Okay, does that make sense? Right. Happy days. Right. So yeah, that is where I'm going to stop. Thank you for listening. Do you have any question? Please feel free to put your question in the comment section. Can I also ask you to please like, subscribe, and comment? Make sure you subscribe, make sure you like, make sure you comment, and please share it to someone that you think that this video will benefit. Can I also tell you furthermore that feel free to contact Too Good Consultant Limited. Okay, we are here to help, you know, to support you with your biomedical scientist interview preparation, including your American Society, you know, for clinical exam. We are happy to support you as well. Okay, then we are happy to support you, you know, for your academic support, and we are happy to also provide you any kind of career support where possible. Okay, right. Thank you so much, and I wish you all the best till I come back your way again. Bye bye.